All right. Well, hello, everyone, and welcome to today's webinar. My name is Chris Boomsma. I'm Chief Executive Officer here at the Council for Agricultural Science and Technology, and it is my privilege to kick off today's webinar event. So, today's webinar is entitled H5Nx Policy Gaps and the Path Forward, a deep dive into the current situation of H5 influenza. And I want to give you just a brief little tutorial on what CAST is, the Council for Agricultural Science and Technology. So, a few quick facts about CAST before we get started. First of all, we're a 501c3 membership supported nonprofit organization formed over 50 years ago in 1972 as a result of a 1970 National Academy of Sciences report. We are nonpartisan, apolitical, and we are a science based organization that focuses on delivering educational information to audiences that need to hear about the latest trends in science and technology in the agriculture space. Our membership includes scientific societies, universities, libraries, nonprofits, companies, and not only organizations, but also individuals from the United States and across the globe. So we're happy to have everyone here with us today. Our mission, very important here. CAS convenes and coordinates networks of experts, and we have experts with us today, in fact, to talk about this very topic. What do we do with those experts? Well, we assemble, interpret, and communicate credible, unbiased, science based information to policymakers, the media, the private sector, and the public. How do we accomplish this mission? Well, principally with the help of many volunteer contributors. You're going to hear from a number of volunteers today. We have a number of board members that participate in our group, many active task force members working on a variety of educational resources, and many, many expert authors and reviewers over many years, including since 2008, over 1,800 individuals. Many of those individuals coming from academia, but also from government, companies, and nonprofits. So, with that, enough about CAST. I'm happy to be here today, as I said, to begin some of the moderation activities here. And so, to kick off to today's webinar, I just want to say a few things. So, first of all, I talked about the topic H5Nx policy gaps and the path forward, a deep dive into the current situation of avian influenza. So with that, this webinar is a second installment of a CAST webinar series. In case you missed the first one, you can find it recorded on CAST's YouTube page. And that is also going to dive into the avian influenza issues that we're facing today. The goal today is to provide a platform for discussing the recently released statement from the American Association of Avian Pathologists, AAAP, on HPAI H5N1. It's an opportunity to explore the policy gaps identified, the necessary actions to mitigate the impacts of H5 influenza, and the broader implications for animal health, human health, and food security. We encourage everyone to join this critical conversation. Of course, we're glad you're here now. If you have any questions during the session, please type those into the chat. We'll address them during the panel discussion at the very end of today's presentations. So with that, I'd now like to introduce today's speakers. So, our distinguished panelists are as follows today. First, Dr. Carol Cardona is the Pomeroy Chair in Avian Health at the College of Veterinary Medicine. In addition to her expertise in avian influenza, Dr. Cardona's research focuses on zoonotic diseases in the intersection of poultry and human health. She co-directs the Secure Food System at the University of Minnesota, collaborating with industry leaders, scientists, and veterinarians to advance strategic approaches to animal health. Our next individual joining us today is Dr. Michelle Crom, with over 15 years of experience in food safety and disease outbreak management. She launched her own consulting business, Food Forward LLC, in 2022, after serving as Vice President of Animal Health and Welfare at Hormel Foods. Dr. Crom specializes in improving the resilience of our food systems, focusing on food safety, animal health, and sustainability. And lastly, Dr. Kay Russo, a veterinary graduate at Cornell University who brings extensive experience in both the dairy and poultry sectors. She holds a Master of Avian Health and Medicine and is a diplomat of the American College of Poultry Veterinarians. Dr. Russo currently runs RSM Consulting, working to find innovative solutions for production, animal health, and performance challenges. Now, to begin our discussion and go into some of the key findings and policy gaps identified in the AAA statement, I'll hand it over to our first speaker, Dr. Carol Cardona. Carol, thank you for being with us today. It's all yours.
Thank you so much. Okay, so H5Nx influenza and how we got here. So I'm going to talk about, give you a little bit of background. Many of you probably already know this, but I think it's always good to start at the beginning. So goose guangdong lineage influenza viruses and how they became a global threat is really the topic I'm going to present to you. We're going to talk about influenza transmission pathways, what we know and what we don't know, and how the nature of flu works to evade our prevention systems and sometimes our best efforts at keeping it at bay. So most of you know that influenza A viruses have reservoirs in waterfowl where there's an abundance of genetic types. So 16 different HAs and 9 different NAs, 105 different subtypes. And H5s and H7s are relatively commonly introduced into domesticated poultry, and goose guangdong has been unusual in its global spread. And goose guangdong H5Nx is our concern today. You might be asking, why am I saying NX instead of N1? And it's because that NA tends to reassort or become changed pretty frequently. So a virus that would be an H5N2 subtype would still would still be a part of what I'm going to talk about today. And we've seen those different iterations of these goose guangdong lineage viruses over the years. So over the years, goose guangdong, our current challenge, has shown us many of its characteristics that I think we're still facing with today's outbreaks. In 1996, it was first detected in southern China. And we need to think back to what was happening in China at that time. There was a tremendous economic boom. Agriculture was booming everywhere. But what hadn't kept pace was infrastructure and bureaucracy. So veterinary surveillance was very weak or non-existent. And in fact, the virus wasn't really detected as a problem until it crossed the border into Hong Kong, where there was veterinary surveillance. So this goose guangdong 1996 arose in a time of social unrest, so economic boom, social change, I should say. In 2005, the virus moved across the Ural Mountains. It gained the ability to move in wild birds and actually became a part of the endemic viruses in wild birds across the Eurasian continent. And so what we then also saw at that time is movement into Egypt and into the Arab nations. And what was going on at that time in 2005, 2006, was there had been this concurrent spread of H5N2 viruses shown in really in the red here. The ones that are up in blue are really not the ones we're talking about. This was a chicken adapted virus spread throughout Asia and the Arabic countries. And it began to reassort with the H5N1. In fact, creating the virus that we see now, many of the component parts of that virus actually come from this H5N2. So the reason I bring this up is because this was a critical step in how this virus became such an adaptable and difficult pathogen to address. Then in 2015, we saw this virus move into North America. And at that time, then, the virus was eradicated from poultry. It didn't appear to become endemic in our wild birds. But in 2022, now that it has come in, multiple times, and we have seen it return in wild birds after their breeding seasons, we think that it's endemic there now, and that our situation of a continuing and ongoing threat from wild birds has become important. And we're going to hear about other species that have also been impacted and are becoming part of those reservoir hosts. So I think it's important to think about, what led to the spread of H5Nx between poultry systems across the globe. So this is from an article from Les Sims, who was the the chief veterinary officer of Hong Kong for many, many years. And he just recently published this, and I think it's an excellent summary. So he says that the production and selling systems that allow H5Nx viruses to multiply and transmit was a key problem. Specifically, production systems, transport systems, and sale systems that had limited biosecurity. Primarily, he's talking about, systems across the globe. So a variety of systems that didn't have biosecurity. In addition, geographically widespread and fragmented segments of an industry that allowed something to happen. So for example, a die-off of birds over here, while a cause was really in another segment, and people couldn't really put that together, especially with flu, where we're talking about, the ability to have no symptoms or limited symptoms in some species like ducks, whereas, domesticated poultry that are not antibody positive are going to die in large numbers. So those types of things led to this multiplication and transmission. The weakness of veterinary systems, both public and private. Now, I mentioned in China what was happening in 1996, economic boom and a lack of veterinary systems. But when we look at Egypt at the time that H5 was introduced there in 2006, it too was experiencing an economic boom, right? Oil prices were had gone up, and there was, Mubarak was in power, and there was likely limited veterinary infrastructure in place. There was a lack of incentives for reporting disease outbreaks, especially among species that didn't show clinical signs. And so ducks became a major issue in these outbreaks, and the reason for the spread across the globe of this highly pathogenic avian influenza. Limited trust in veterinary services and or governments, was a part of this, as well as the availability of alternative avenues for sale of sick or even dead animals. Now, this is, Dr. Sims is talking how this spread through poultry systems, but I think we can easily see that these same points can be made about the types of spread that we're currently seeing. So influenza A viruses may surprise us, but maybe they shouldn't. We tend to forget the rules of flu. So I heard on a call recently, no one predicted H5 influenza would emerge in cows. Okay, not specifically, but if we back out, we do know that influenza A viruses love hosts, a variety of hosts, naive hosts. And we've seen this over the years, and we're always, sort of taken aback of, wow, who could think alpacas? Who could think, we need to probably not be surprised at that. Flu likes a lot of hosts, and it likes naive hosts. We also need to remember there are a lot of cattle sharing the planet with us, right? So cattle represent, one of the biggest biomasses on the planet. 35% of the mammalian biomass on the globe is cattle. So maybe it was just a matter of the odds that they would become infected. And we also know that we only know a little bit of what is true about influenza. So we have some known hosts, but we also know that there's 1,000 mammalian species in North America and 2,000 avian species. The ones that we know, we kind of know, but the ones that we don't know, we really don't know. We don't know if they're a part of the ecology of influenza or not, because we really haven't had time or the funding or the need to explore them. So it's important to know that we just maybe don't know. It's important also to think about, as we're talking through this, these policies, that the dynamics of transmission are largely through human activity. And it's more likely to occur when there are subclinical cases than when are clinical cases. And you saw that in the listing of things that, Dr. Sims talked about, that we are seeing, that we saw the movement of ducks throughout Southeast Asia through the trade of ducks, and that's how the virus spread initially. Once we recognized that, we began to do more testing associated with trade, and that things changed. So Dave Halverson, our colleague from here in Minnesota, likes to always say, low path avian influenza spreads through networks, but high path spreads locally, meaning that low path avian influenza in birds is not going to be clinical. And so people tend to think it's okay to move those birds and that they can move them. But high path, when those birds are dead, it's very hard to mask that and really move them. So in other words, we are familiar with this type of diagram where risk is really highest at the center of the circles where our infected premises is, and risk decreases the further away from that infected premises that you get. And this is the type of spread, local spread, that you would expect to see with a high path virus, where the amount of virus is going to dictate where the virus goes. In contrast, a low path virus tends to spread by networks. And this is an example from way back in 1986 of how a low path virus spread across farms in California. So the farms are separated by miles, and they even skip farms. It skips farms that are between them. And that's because this was spread by an artificial insemination crew. So the spread was by fomites, not by local area spread. So now if we go to a nextstrain.org map of this current outbreak, I think you can see that there's a combination of those types of spread, right? There's both this movement by network, and then once that network spread happens, there appears to be quite a bit of local area spread. So movement is definitely a part of how this virus is spreading, and it's not completely one type or the other. So flu viruses are dynamic. They change through mutation and reassortment. That means they can evade detection, immunity, and control. They can also change their phenotypes, which means they can be different to look at, and they can change their host range. They change in different ways and at different rates based on the host that they're in, which makes this, flu very, very complex to stay ahead of. Flu viruses look and act differently in different hosts. So the point is, don't get attached to what you see today because it might be different tomorrow. And with flu viruses and my experience with them, I would just say never say never. Never predict that it couldn't happen this way or that way, because it just might. So in conclusion, the spread of goose guangdong H5 influenza across the globe has followed really human social upheaval and division, economic booms, there's war, social unrest, and political divisions. Goose guangdong surprises us, but really it shouldn't. Transmission of subclinical and mildly clinical cases happens through movements and follows networks. And we need to remember how little we really know about this. With that, thank you.
Carol has been there for me from the beginning with this outbreak as a mentor, and also a wise sage when it comes to the laws of flu. But today my goal really is to provide an update of sort of where we've been with this particular strain in dairy cattle that we refer to as B313. And the question becomes, are we doing enough? So I threw up this slide. It's kind of funny, but in working in identifying the first clinical case with the field veterinarians, they're dairy veterinarians. I was a dairy veterinarian for several years, sort of moved over into poultry, but they referred to me as the crazy bird lady because I was pulled into this in early March, about March 13th, I want to say, and there was this mystery cow disease circulating through the Texas Panhandle, and the veterinarians were getting worn out. They'd really exhausted all their testing options for the usual suspects. And I was asked to give a call to a veterinarian, Dr. Barb Peterson, to really see if I could help. And so I thought, oh, great, I'm sure Barb really wants to hear from me, the crazy bird lady. But I called her and we talked through sort of what she had already run in terms of diagnostics and what her suspicions were. And I said to her at the end of it, I said, well, it's probably just some novel coronavirus, but I would be remiss to not mention the fact that I have watched influenza jump into a myriad of mammalian hosts for the last 2 years. And I provided her with an article on sea lions being infected in the Southern Hemisphere. And so she said, well, no one else has provided me with a better alternative option, so I'll follow you down this path. And serendipitously, later that evening, I spoke to another contact that asked me to speak to Dr. Nick Schneider. And Dr. Schneider basically, I sent over the article and he called me immediately and he said, "Do you think this could be flu?" And I said, "I think we need to consider it in the realm of possibilities." And we got to talking and we're talking about what else is going on the farms. And he said, "Well, we have a ton of dead birds." And I thought, oh goodness. So I told both Barb and Nick the following day to grab some of those birds, open them up, send me pictures, and also to submit them for influenza A testing at the diagnostic lab. So inevitably, as we move forward over the time course, we found that those wild birds were in fact positive for H5N1. And at that point, we all started to get a little nervous. And I told them, guys, I know on the poultry side, if it's diagnosed, it's essentially depopulation. I don't know what they're going to do here if this is the case in dairy. So we were all having these existential crises. I called Carol one night, kind of flipping out about it. But we pursued it. We were trying to tell the state vet we thought it was this. I tried to tell the bovine vets that it was this, and I reached out to NVSL and sent an email about essentially the signs we were seeing, the positive birds, and they just didn't respond. And later I found out they got the email and just didn't respond because no one knew what to say. But finally, we were able to push it to the point where Barb got a diagnostic lab, Iowa State, to run it flu PCR on milk. Nick had submitted samples prior, but nobody would run them because it wasn't in their book of what they run. So inevitably, that's how we came to this diagnosis. And it was a function of sort of having to fight an uphill battle against status quo and where we expect to see flu. No one was expecting to see it necessarily here, but in looking, that's what we found. So I've listed some of the basic clinical symptoms that we see on these farms: respiratory disease, some signalment, digestive upset, drops in rumination, drops in feed intake, a marked drop in milk production, and mastitis in a number of these animals. And a lot of the farms are describing the disease as mild, but some of them I've heard mortality rates of those affected reach 10 to 15% of clinicals. So that's a fair number of animals that they're losing due to this. Now, as we were seeing these dead birds, we also started to note, Barb and Nick were noting sick cats. So the cats would present with respiratory signs, which would quickly move into neurologic symptoms, as indicated by the video here. And that shortly was followed by the cats succumbing to the illness. H5N1 was found in very high levels in these cats' brains. Sorry. So how did this come to be? So Warby did some work earlier this year after the outbreak started, and it's suspected that the virus jumped from a wild bird into a cow sometime late 2023 to early 2024. Now we're at the point where we have 14 states affected. California is the new hotspot with over 40 dairies that have purportedly come up positive and probably growing. So that's the situation today. And Carol had shared that next strain image, but I wanted to put this video up here because it really shows how this outbreak progressed, starting in Texas, and then when we diagnosed this, I expected sort of the feds, I guess, to come down and give us a hand, but there was actually kind of sort of this gaslighting that was going on. There was state vets suggesting that there was no evidence of cow-to-cow transmission, even that this wasn't a primary disease, but an incidental finding. And, some folks were, on the state vets calls were saying that local poultry operations that were coming up positive, it was unrelated to the cow variant. So I sort of watched in horror as they kept cattle movement open in the name of business continuity and welfare. And to the point now today where we've got 14 states affected and tons of animals. And so that's how we've gotten to this point today. So I wanted to share some recent publication. These folks did a challenge study in a BSL-3 lab of infected lactating cows and calves. And what they showed, I just pulled out sort of what I thought were key points from this study. They showed that this B313 strain can infect cows, but they also challenged a subset of animals with a Eurasian lineage H5. That also infected cows when administered by a dose right up through the teat canal. Some of the cows got very sick to the point that some were neurologic. I pasted a video here of a neurologic animal on a flu-infected dairy. I don't know if it's related to flu, but I'm a bit concerned now that I'm seeing some of these publications. The highest concentration of the virus is in the milk and udder, which is not surprising. What this also showed that there was some level of shed in the urine, and there was recovery of the virus in neuronal tissue. Now, they also went through and infected calves in the nares, and what they found was that calves can get infected, surprise, and they shed the virus nasally. They put some sentinels in with those calves, however, the sentinels didn't get infected. But this does pose a question. What's the risk factor of young stock, non-lactating, for getting infected and onward transmission? So I'd really like to see some intranasal or oral inoculation studies of lactating cows and see if that's in fact resulting in test positive milk. And also just looking at better defining sort of how this virus is moving, because I think there's a piece we're missing beyond just a spread associated with the parlor. Perhaps there's a component of respiratory spread to this as well. So early on, as I mentioned, really nobody came to help. So the small group of veterinarians that initially diagnosed this disease started to sort of mobilize. And what we did is we were grabbing samples on animals because we were trying to answer questions for producers about how the virus was spreading. Now, one of the things we did was we took convalescent sera from dairies and submitted it. And what it showed is that there was a certain percentage of non-lactating animals that were in fact seroconverting. It's not a ton of animals, probably 10 to 15% of those tested in our very small sample size. But again, it's not perhaps just lactating cows, but what's the risk of onward spread? This is some additional data that we generated. This is looking at convalescent antibodies 7.5 weeks post-infection on a dairy. So you can see the cows, about 70% of them seroconverted of those tested. What I found was interesting was the pre-weaned calves. So these are calves on waste milk on the dairy, and they seroconverted. 64% of them show some level of antibody. Now, whether those are colostral-derived antibodies, perhaps, but there was some recent work that was spoken about at the Lehman Swine Conference that suggested feeding calves infected milk does result in clinical symptoms and seroconversion in those animals. And so again, we need to keep this option open as we consider control tactics. And then if we consider, how dairy operates, any dairy typically replaces a fraction of its herd every year. So generally it's around 30%, give or take. So 30% of the cows that are no longer productive go to slaughter, and they're replaced by typically replacement animals. And if we're only seeing 10% seroconversion in those animals, that means we're constantly adding in naive hosts on these operations for that virus to jump into. And I think we're seeing that reflected in the fact that many of these herds, months out, we're still having fresh cows that are coming up positive on PCR of the milk. So again, how do we manage this in the confines of the current dairy industry's structure? Now, how widespread is this virus? So, they announced, oh, yes, we confirmed H5N1 in dairy cows, and that was literally 3 days after we'd gotten the initial results. And then FDA came out and said, oh, milk's safe. There's no H5N1 going to the processing plants. Well, they had to kind of backpedal, and to the point now where we're seeing about 20% of the dairy products on the shelf contain RNA from H5N1. So there's still virus isolation negative, thankfully, but it just shows you how darn ubiquitous this virus is in the dairy industry today. It hit me really hard. This is a picture of my son. When it hit Colorado, I went out and collected some samples from the shelves, and I went to have lunch with my son at his school that day, and I thought, oh, what the heck, I'll grab some milk from the school, and I grabbed this particular milk sample highlighted from my son's best friend, and got that result back, and it was positive, and it kind of hit me like a ton of bricks, really how pervasive this virus is, and how much control we do not have at that point, and still today. So, we get a little bit siloed in our industries, and in the dairy industry, the poultry industry, it's no different, but you don't think perhaps about the ramifications of this disease outside of your vacuum, right? And what we're seeing here with this outbreak, and even on the poultry side, when we've seen outbreaks in the past, is there's spillover. Right? There's spillover to surrounding wildlife that share geography with these operations. And I pulled this from the USDA website. In this current outbreak in the Weld County, which is the county next door to where I live, they've recovered a ton of mice that are positive for H5N1. And so we're seeing these spillover events. Alpacas tested positive in Idaho for the virus. They were dumping their cria, so aborting their crias, and they were finding levels of virus in those fetuses' brains. And I've heard recent information that feral pig populations, they're finding that a small portion, maybe 4, are H5 positive on HI out of a random sampling of maybe 4,000 pigs. So this has a ripple effect into wildlife, into other commercial operations, other species that we need to consider as we consider control tactics. Also in Colorado, we've had house cats come up positive for the bovine variant. How the heck's it getting in? Maybe it's the mice, but truly, we don't operate in a vacuum here. So we need to be considerate in terms of how we control this virus. And obviously, the poultry industry has suffered great losses. We've lost close to 20 million birds since April 2024 due to this bovine variant. 8.8 million birds in April, which is the highest month so far in US history, due to the bovine variant. So what has the government done? A month after the initial diagnosis, give or take, they decided to launch a federal order, which would essentially require testing of lactating cows moving between states. It says nothing for non-lactating animals. It says nothing for intrastate movement of cattle. So that's where we're seeing a lot of I think in part of this ballooning within states once a case makes its way in, is because there's really no, in most states, there's no structure to monitor it. Colorado Colorado stepped up to the point where they've started weekly bulk tanks, so monitoring of all grade A dairies. And sure enough, they recovered a number of dairies that were reporting. Most of them have, but a few hadn't. And ultimately, they're also seeing this yo-yo effect. So a dairy will be, negative for a while, and then it'll pop positive again. And I think, again, that has to do with the introduction of fresh animals, naive animals into these herds, to the point where they're actually reducing the CT level down so that farms can leave quarantine because of this sort of yo-yo, which is a bit concerning. And then we have the human toll, right? We have veterinarians and animal caregivers that are kind of caught in the crossfire of this. Huge increases to work hours and workloads. There's been pressure to conceal from the start. A lot of dairies looked at this like the scarlet letter. They didn't want to be labeled as positive. And so, they would say to their vets, please don't report me. I've heard rumors, and I hope this isn't true, that processors have told farms not to comply and not to report, which, again, I hope that's not true. But then there's also been a lot of job loss fallout from it. So vets, for instance, that say refuse to write health papers for presumed positive dairies to move into negative states. I know of a vet that lost a job for advocating for worker safety, because at the same time these cows were getting sick, there were a lot of workers getting sick. I know a veterinarian that lost a client for being vocal about this publicly. I myself was told by a previous employer to be quiet, or I'll be put on unpaid leave for talking about this because I'm a risk to shareholders. So this is an extraordinary amount of stress put on folks that are in the crossfire of this situation. And then we consider on the poultry side the depopulation, the mental health impacts of that on those that have to basically carry that out, and then the downstream impact on the growers, the paperwork, the responsibilities post depopulation, and then the processing facilities. I mean, jobs are hinge on having throughput through these facilities, and when you have depops like this, it affects it. And then this proverbial monkey in the middle, right? So you've got veterinarians that are USDA accredited, that are supposed to do this duty, but they're afraid that, if they fall out of the federal order or whatnot, they're going to get in trouble, get their licenses revoked, get put in jail for running serology. We don't need that. This is hard enough. And then again, the human impact. Humans have receptors for these influenzas in their eyes. So a lot of folks are showing sort of this wicked conjunctivitis. And, in terms of reporting, it's been severely underreported because essentially, there's no structure around it. Now, I asked the CDC director, Dr. Todd Davis, why they recovered this poultry sort of group after the depopulation in Colorado. And he said because it's a routine monitoring. These are USDA contracted groups, and they monitor them for 10 days post depopulation looking for symptoms. And that's how they found them. There's nothing like that on the dairy side. A lot of these folks are undocumented, and these infections are contracted out so long that it would be a horrendous undertaking to monitor it for that period, but something needs to be done. So what are we seeing in humans? Conjunctivitis, mild hangovers, list goes on. They're relatively mild symptoms. And so most of them are like, not reporting, I don't want the heat, it's mild, what's the big deal? But the concern here is for reassortment, like Carol alluded to. Thankfully, these patients aren't experiencing high mortality rates like what we see with H5N1 globally, but influenzas reassort, they mutate, and we don't have a crystal ball to know how these changes will impact virulence, to the point where CDC is recommending seasonal flu shots in workers in trying to thwart a reassortment event between a seasonal flu and the B313 strain. Finland is offering H5 vaccines to workers at risk, so mink farm workers, poultry workers. So the final thing I want to mention, this is a Missouri case, a human case, no animal exposure. It was the dairy cow variant. This person was immunocompromised, but they were hospitalized. Now they had a close contact and two of the healthcare workers that also showed symptoms. And the delay in reporting on this is a bit of a concern because it may impact identifying clusters of human cases in an area. Is it such a far reach to believe, after what we've seen it do in cows, that it won't adapt to human transmission? We need to be more proactive about this. And I wanted to throw this up because I think, I'd hazard to guess some of the cautious response to this has been due to a balancing act between maintaining trade in the face of foreign animal disease threat. So I've graphed the US export dollars out by industry here. So dairy, about 8 billion, beef, 10 billion, so on and so forth. Now, I also pulled this from a recent, or I guess, a recent article in JAMA, which essentially looks at the dollar amount associated with COVID-19 in the US. So if we look at that respective to the export industry, ultimately at the end of the day, the relative cost of lost trade is really no comparison to another pandemic. So ultimately, the goal and the hope is that this doesn't turn into that, but it could. It's one of the options. So let's get ahead of it. It's not the dairy industry's fault or the poultry industry's fault that they got infected with this virus, but it is our response today and our response tomorrow that will define the sustainability of our industries. We need to do better. And with that, I will hand it over to Michelle.
I'm going to take a step back just for a second and talk about what happens on a poultry farm when it gets impacted by HPAI. So in the upper Midwest, the typical case presentation is being on spring break as a veterinarian and getting a call from your local turkey producer. And she's reporting that the turkeys are abnormally quiet and their water consumption has dramatically decreased, both of which can be clinical signs for a wide variety of issues and diseases, including highly pathogenic avian influenza. So this is a snapshot of what she might have seen when she went into the barn in the morning to do chores. Just a quick note, turkeys are naturally curious creatures. So although they look very crowded in this picture, outside of the frame of this picture, there's plenty of room for them to move around. For those of you not familiar with turkey behavior, I've circled an area which kind of demonstrates what depressed turkeys look like. So their heads are down, their feathers are very ruffled. So after consulting with her veterinarian, they come up with a game plan, and Farmer Jane goes back out to take her samples to help rule in or rule out a variety of diseases, including HPAI. When she enters the barn a couple hours later, this is what she sees. So one of the things that happens on the poultry side of things, unfortunately, is that we have a really well-defined and well-practiced playbook for what happens on a farm when it goes positives. So that playbook includes all the things related to virus elimination on the farm, bringing it back to negative status. In addition to what happens on the positive farm, we do surveillance. As Carol had mentioned on her presentation, we think of HPAI as a local spread. So we have our state and federal folks go out and test all the farms in the surrounding area, both commercial and backyard, to try to find the next case. And all that work relies on a lot of collaboration between both the federal and industry in that local area. Federal and state resources, drive kind of the outcome for a given foreign animal disease response. So in this case, stamping out the disease on any positive poultry farm. But that is done most efficiently when the regulators include local industry. Industry is able to then help them identify where important resources are and get everybody to that outcome of elimination more efficiently. Okay, so there's a couple different challenges. One is in poultry, we know clearly that we're working towards stamping out of the disease, and we have highly aligned navigation tools, a whole series of policies that have been refined over time to get us to that point. With B313, really, we're having problems with the destination and getting agreement upon what the destination should be for all passengers. So for our regulators and for the various industries that have been impacted. This isn't being helped by misaligned navigation tools. So we have some policies that are out there, but they're really not getting us to where we need to be. Next slide, please. The next piece to this is the vehicle. So when we're thinking about poultry responses, really it's a well understood operating system. We've spent a bunch of time, unfortunately, really sorting things out, creating space for everyone's voice to be heard, and so we can all get together and very efficiently stamp out disease. With the occurrence of B313, it's really a novel operating system. We're still trying to figure out what this virus is, how it's moving, how it's affected the various species that it has impacted. And it really feels like we're kind of stumbling over each other and there's not enough room for everybody. In addition, we're all kind of bickering in the backseat, trying to decide from our viewpoint what the navigation strategy should be to get us to whatever that destination is. Next slide, please. And this is all being kind of navigated by our regulatory bodies as the drivers. Really, they're the ones that are in control and have to drive the vehicle from a resource and policy standpoint, as well as trade, as Kay mentioned in kind of her closing comments. The challenge here is that the driver has to be trusted by all passengers in order to get everybody to the destination safely. And I don't think we're quite to the position where everybody's on board and feels good about trusting the driver to get us to the destination. Next slide, please. So that leads us to why ultimately we're here this afternoon, and that is to review some position statements that the American Association of Avian Pathologists put together regarding H5 influenza. Next slide, please. So the first ask is that we collectively put together a consistent risk-based national strategy that adheres to the science-based principles of disease control to reduce the further spread of influenza. As I indicated in my previous slides, there doesn't feel to be a cohesive approach to disease control with B313. Next slide, please. Of course, in order to do that, we need to generate science regarding where the virus is, where it's not, as well as how it's being spread across species, including cows, dairy cows, poultry, and people. Next slide, please. The next request is to really take a look very closely at the role of vaccine and how vaccine could be utilized to reduce harm across all those impacted populations, which includes poultry, dairy cows, and people. Next slide, please. And finally, we realize that all of those requests require a heavy uplift, of a need for resources, both lab capacity, producer, veterinary services, and of course, just capital to get all those things done. So we want to draw attention to the need for additional allocations for minimizing the long-term impacts of H5 influenza on human health, food security, and economic sustainability. Next slide, please. And of course, we realize that this is going to evolve over time. As we generate more science, we would fully expect that the policies would be adjusted to reflect what we are coming to understand and learn about the virus. I think the good news is that if we navigate that process together in a collaborative approach, it'll give us an opportunity to build more trust between all the stakeholders being impacted by this virus. Next slide, please. So in conclusion, we need all stakeholders to be engaged to reach a resolution. One lift from one affected stakeholder is not going to bring this virus under control. Field level data is required to inform science-based policy and risk mitigation approaches. We need the science in order to make sure that the policies that are put into place actually get us to our desired outcome. And then finally, it's crucial to explore vaccine programs for at-risk animal and potentially human populations to break transmission cycles. Thank you.
Hey, Pat Klein, nice to hear from you. H5 and H7 strains have been documented historically to cause conjunctivitis in humans. That's right, and that's primarily because humans have the avian type receptors in their conjunctiva, and often that's how we're exposed. And so, those of you who've been around Newcastle virus vaccinations, you may have gotten that red eye that's super painful, sometimes called Newcastle eye. Well, that's for the same reason. You get this local infection around your eyes. And yes, exactly. PPE is important to reduce the risk of exposure. And Pat, as you know, we really need some help with new PPE because it's very difficult for people to work in the complete PPE that we have seen recommended. We all know that that's the optimal, but we really need some help in figuring out how to help people protect themselves in farm situations where they're conducting full physical work, while masked and goggled, etc. So thank you for the question. So was there isolation of the virus from those cases, Kay?
I think I'm not sure if they were able to pull it from. I think they were able to pull isolation or the actual live virus from the New England Journal of Medicine case. I think they were able to pull it from a case in Michigan. So there's been a few that they're able to pull it from, but sometimes by the time it gets to the CDC, for instance, the viability of it has been essentially compromised. And so for those that they have been able to pull live virus, they've looked at it in different models, ferret models, otherwise, to look at potential impacts to humans on a greater scale. But again, it's variable depending on the case. And also, we're missing a huge portion of these cases due to lack of reporting, whether the folks are going in and the local health system isn't testing for it. I spent like 2 hours on the phone one night early on in this outbreak trying to find a local clinic that could test workers for influenza A in the Texas Panhandle, and I came up empty. And so there's a health infrastructure issue, a lack of understanding of this virus in these hospital systems currently, coupled with trying to get it to the CDC to actually get it grown up. So I hope that answers your question. Probably more than you wanted to know. I can take that one. So unfortunately, dairies have been, or fortunately, they've been very lucky up until this point to not have a major health issue such as this one that would require significant changes to bolstering biosecurity practices. And so by and large, dairies are very bio-insecure places. You've got dead trucks coming on and off. You've got calf trucks coming on and off, salespeople on and off all day. Feed trucks on and off, breeders. You've got people driving down the feed alleys with tires with poop all over them. So by and large, if you look holistically at the dairies, they're very leaky. In the parlor themselves, even a lot of the individuals, even if offered PPE, aren't wearing them because the glasses fog up. They've got 12-hour shifts and they don't want to stand there having to deal with fog glasses and masks the whole time. And so it's just sort of this perfect storm. And this virus has found this extraordinary host that it doesn't kill, that sheds a ton of it. And so it's kind of, again, this perfect storm. So it's going to be a learning for the dairies as to how to navigate around it.
I can start with that one, and then maybe we can all chime in. So the main obstacles for a national strategy. I think there's a couple issues. One is that H5 influenza virus in cattle has been a very tricky space for jurisdictions to navigate from both a federal and a state level. Both parties trying to figure out kind of where the guide rails are from a regulatory standpoint, what they can and can't do. And I think that's their initial attempt, they being USDA in this case, initial attempt to really try to gather and collect some of that surveillance data that we so sorely need was a voluntary program. So their initial step was, asking the dairy industry with a few incentives to actively participate in building up that science-based information we need to put together a national strategy. And so I'll pause there and see if Kay or Carol have additional viewpoints on that.
So I think you're spot on, Michelle. And I would suggest to you that if we're talking about a national strategy for H5 influenza control, we have to recall that there are many more hosts involved now than just cattle and chickens. And so we saw the cats in Kay's presentation. But if you go to your local small animal veterinarian and, present a cat with the signs of HPAI in cats, they would probably, cut its head off and have it examined for rabies. And I think it's important that, to understand that this is, really an all species challenge that we need to address in that way. And so, I would say that we are very fragmented, as a veterinary profession and as groups of people. So we're thinking often of food animals, but we have to remember that this is an equal opportunity pathogen.
I can take this one. So this has been sort of the million-dollar question as we talk about naive animals entering the herd as being sort of an opportunity for this virus to be perpetuated in the herds. It seems natural to think utilization of a vaccine to improve their immunity might help to stall some of this viral cycling, essentially. So according to what I understand, the CBB has sort of loosened the reins recently to allow for in-vitro testing of essentially killed vaccines for influenza. And before, you had to conduct all these tests in the BSL-3 laboratories. So I guess that's a way of trying to move things forward. So they're investigating options for vaccines, but loosening these reins, as I understand it, speaking to manufacturers, doesn't necessarily ensure that these vaccines will receive a license, or if they do receive a license, that they will be allowed to sell them. And so I think this, again, swirls in this pot of trade, right? If we vaccinate it, then it may be considered endemic. And what does that mean for trade? So it's a bigger question than I perhaps can answer on this, but I know there's at least a perceived effort of moving forward with it.
All right. Well, I want to thank everyone for submitting your questions today. And of course, I want to thank each of our presenters, Kay, Carol, Michelle, for answering those questions. It's been a privilege to have you here with us. I'm sorry, everyone, some of the hiccups we had. We were trying feverishly in the background to get our wonderful moderator, Mustafa, to come on, and he just could not get his connection to work, which threw us off just a little bit as we were hoping he would be with us today. But I want to thank publicly Mustafa because he did a lot behind the scenes to get this webinar put together for us. So he tried his hardest to be here, just couldn't make it and get a connection to work. But Michelle, Kay, Carol, definitely thank each of you for the great insights that you provided with us today. With that, folks, we're going to wrap up today's webinar. I just want to say thank you for joining. If you would like to learn more about CAST, go to our website, cast-science.org. Follow us on any of the social media channels that you see on the screen at this time. And we'd love for you to become a CAST member. You can scan that QR code at this time. Thanks so much to our friends at AAAP for teaming up with us on this webinar. They are truly the experts in this space, and we're happy that we could partner with them. With that, thank you, everyone, and have a great day. Bye-bye.